people perceive trauma differently. And so as adults, we often think of trauma as some big catastrophic event, whereas really trauma can be anything, especially with children. My name is Trisha Clough, and I am a home-based therapist at Lifespan Clinical Services. I am now certified in the trauma-focused cognitive behavioral therapy model. I got that certification through the state of Michigan, and I received it about 2 months ago. TF-CBT, or trauma-focused cognitive behavioral therapy, is kind of a process of helping children work through any trauma that they've experienced and kind of help them work through it in order to decrease the symptoms that they are experiencing. I think it's important for teachers and everyone dealing with children to be informed so that they can recognize the symptoms of trauma and get these children the help that they need. It's important that the community have a trauma-focused and trauma-informed view, because unfortunately this is a time in our society when there are a lot of budget cuts, especially in the area of mental health. And these trauma-focused therapies are pretty short-term, so if we can address the trauma and do these short-term therapies with these families, then we can help them improve their lives and treat their symptoms, in a short period of time in the best way possible. I've seen results with 3 clients that I've completed the model with so far. With all 3 of them, their symptoms have significantly decreased by the end of the trauma therapy. I think my favorite part is just seeing the difference in families. They often come to us at their worst, when the symptoms are the highest, the behaviors are the worst, and being able to work with them and seeing little progress at first, and then by the end seeing just a huge change in not only the child's behaviors but the whole family and how they relate to each other.